As a continuation of last class GIC, we will be continuing with the modification in glass ionomer cements. Now, in glass ionomer, in this topic, we will be discussing about the highly viscous GIC, low viscosity GIC, metal modified GICs like Miracle Mix, Cermet, resin modified GIC, polyacid modified composite resins, or also called as compounds, and self-hardening GIC, low pH smart materials, fluoride charged materials, bioactive glass, fiber reinforced glass ionomer cements, geomers, proline containing GIC, calcium aluminate containing GIC, and others like amalgamas, hanomers, chlorhexidine impregnated GIC, CPP, ACP containing GIC, zirconia containing GIC, nano bioceramic GIC, and powder modified glass ionomer cements. So these are the various modification in the GICs. There are so in detail, we are not going to explain everything in detail, but which are the important things, as well as you should know about the importance of different names and the little detail about the other GICs. So it's just not alone the traditional GIC or the conventional GIC. We have so many modifications also present in the GICs or available in the GICs, but which we are not regularly using all these things. But at least we should know about all these things a little by little. High viscous. If you discuss about highly viscous GIC, here the restorations of teeth under conditions of minimal instrumentation currently used in the third world nations. So it's also used in the atraumatic restorative treatment, that is ART. Here the tooth preparation is very minimal. The particle size, the powder liquid ratio, particle size and the powder liquid ratio, which will increase to obtain the high viscous mix, and it has got high strength and better physical property. And the other uses for this highly viscous glass ionomers are, they are used in core buildup, primary tooth filling, non-stress bearing areas restorations, and intermediate restorations. How do you manipulate this high viscous? How do you manipulate this high viscous GIC? You isolate the tooth with a cotton roll, accessing the caries lesion with a hand instrument. With the hand instrument, you just remove using an excavator. Remove the undermining caries, which is the soft tissues are there, and use with a weak acid to prepare. Use an acid to prepare the tooth in that area, which will enhance the chemical bonding, and the placing a high viscosity of GIC by using a finger pressure. That's all. This is what which we can. It's easily we can use it. We can manipulate it very easily. What are the advantages of this cement? They are packable and condensable. They are easy to place. They are non-sticky. Their early moisture sensitivity is reduced. Rapid finishing can be carried out. Improved its wear resistance. Low solubility in oral fluids. But it has got a few disadvantages also. Like due to their opacity, they have aesthetic disadvantage, and they have limited life potential and moderately polishable. Now, next one we'll discuss about metal modified glass ionomer cements. Metal modified glass ionomer cements, we have two things. One is Miracle Mix, another one is Cermet. What is metal modified glass ionomer? Glass ionomer cement lacks its toughness, so hence it cannot withstand high stress concentration. So they have been modified by including metal filler particle, which will improve the toughness. So Miracle Mix. Let's discuss a little about it. Miracle Mix is introduced by Simmons in 1983. It's a silver alloy admix. It is a silver alloy admix. Sked and Wilson found that amalgam alloys can be incorporated into the glass ionomer cements. So this alloy powder can be included into the glass ionomer cement. So here, how do we do it? 8 parts of the cement to 1 part of alloy by volume. That is 8:1 is the ratio. Mixed to the suitable consistency with polyacrylic acid at a ratio of 3:2 by weight. Incorporating only silver alloy powder without mercury, and that is miracle mix. So there is no mercury which is added over here. It is only the amalgam alloy powder into the glass ionomer cements. Here the aesthetics is very poor and impart to a gray to blackish color to the cement. So when it comes to the cermet ionomer cements, it is an attempt to improve the abrasion resistance and strength to the GIC that is introduced by McLean and Geyser in 1985, developed the cermet ionomer cement. This contained glass with metal powder sintered into the high density that can be made to react with polyacids. Here, microfine silver alloy particles of 40% weight and less than 3.5 on diameter mixed with glass particle and sintered together at 800 degrees centigrade under pressure. Here the 5% tin oxide is used to modify the color. And then the pellet is formed and ground into fine particles. Here what happens, the powder is then powder of the glass ionomer cement and the alloy powder is mixed together, and as they said, it is mixed and in a glass and sintered at 800 degrees centigrade under pressure and made it into pellets. In this pellet then ground into fine particles which is filled into the cavities. What are the properties? Compressive and tensile strength is more when you compare with the traditional GIC. Modulus of elasticity is lower than the conventional glass ionomer. Abrasion resistance is more, resistance to abrasion. Radiopacity approaches that of the dental amalgam. Fluoride release, say for example, fluoride leaches out from both metal modified systems in an approachable amount. Less fluoride is released from the cermet than the silver alloy admixed glass. So adhesion is slightly lesser than the conventional GIs. What are the indications of this one? That is used in conservative class 1 cavities in primary tooth. Core buildup material can be used in lining of class 2 amalgam restorations. Root caps for teeth under overdentures, and preventive restoration and temporary posterior restoration. What are the contraindications? They are anterior restoration. It cannot be used in the anterior areas and areas subject to high load. Now let us go to the discuss about the resin modified glass ionomer. Here what is resin modified? Resin modified glass ionomer materials that are modified by the inclusion of resins generally to make them more photocurable. Here the composition is powder is iron leachable fluoroaluminosilicate glass particles and initiators for light or chemical curing or both. The powder particle is iron leachable fluoroaluminosilicate glass particles and initiators. That is for light. Initiators are used for light or chemical curing or for both. Liquid is aqueous solution of polyacrylic acid, hydroxyethyl methacrylate monomers, and polyacid modified by methacrylate. The powder liquid ratio is 3:1. Here the setting reaction, that is polymerization of methacrylate group, it will be having an umbrella effect provided by the set resin. Set mix is hemopolymer and polyacid linked by, and the mixing time is 30 seconds, working time is 2.5 minutes. It's a dual cure and 2 reaction will be the tricure. It is like polymerization by chemical, light, and an acid-based reaction. These are the things available in the market, but very rarely it is used. It's all depends upon now. When you can use a composite 100%, they prefer to have a composite not than the GIs. What are the properties? It is the properties. They are better in translucency. When you look at divide the properties in translucency and color, it is better than the conventional GIC due to the presence of monomer. Solubility and disintegration, they appear to be more resistant to solubility and disintegration than the autocure GIs. Fluoride release say for fluoride release, the light cured GIC liner releases more fluoride, and the strength is the diametral tensile strength, flexural strength, and the fracture toughness is improved. Then the dimensional change, very small initial shrinkage of the resin component at the time of light activation. Marginal adaptation, they exhibit a greater degree of shrinkage on the setting due to polymerization, reduced ability to wet the tooth substrate due to the lower water and carboxylic acid. Biocompatibility, initially the pH is less acidic. Addition is same as conventional GIC. The advantages are it can be finished and polished immediately after the set. Repairs can be carried out as bond between old and new material is very strong. It exhibits increased addition to the composite when used as a base. It is ideal under composite as it can etch immediately. Fluoride release is greater than conventional GIC and compounds. High diametral strength of 20 megapascal. What are the uses? It is used as a liner and base, fit and fissure sealer, core builder material. It is used in restorations. It is used as adhesives for orthodontic brackets. It's a retrograde root canal filling material. It is repair material for damaged amalgam forward cusp. Next one is compomers. They are polyacid modified composite resin. It is suggested by McLean in 1994. That is the composite resin plus glass enamel. And here the structure and the physical property is similar to the composite, and the ability to release fluoride and undergo acid-base reaction is in the presence of saliva. Polyacid modified composite made by incorporating glass particles of GIC in water. Free polyacid liquid monomer with an appropriate initiator. What is the chemistry and setting of this? One paste light cure material for a restorative application contain non-reactive organic filler particles, reactive silicate glass particles, sodium fluoride, and polyacid modified monomer without water. It is sensitive to moisture. Setting is initiated by photopolymerization of acidic monomer and yields rigid material. Functionally hydrophobic, but to lesser extent they absorb water from saliva and begins to acid-base reaction. It leads to fluoride release. Bonding mechanism, dentine bonding agent required. Bond strength is similar or higher than hybrid composite, and that is hybrid composite, that is 8 to 24 megapascal. Water uptake is 3.5% by the compressive strength and flexural strength of the compomer decrease on the storage in saline solution. Here the clinical performance, as you say, color stability, changes in RI and water sorption in staining by regular change in regular intervals and water sorption and staining by food. Indication, sealing and filling of occlusal pits and fissures, restoration of primary teeth, minimal cavity preparations, lining, core buildup, repair of defective margins in restoration of class 3 cavities, class 5 cavities, erosion lesions, sealing of root surface for overdedges, potential root canal sealers, and retrograde filling materials in endodontic surgeries. What are the contraindications? Contraindication cannot be used for class 4 caries lesions. Lesions involving large areas of labial surface, class 2 caries lesion where conventional cavities are repaired and lost cusp areas. What are the advantages? Coming to the advantages, we have superior working characteristics to resin modified GIC, easy to use, easily adapts to the tooth, and good aesthetics. Now, what are condensable and self-hardening GIs? These are basically purely chemically activated resin modified GIC with no light activation at all. Mind you, they are basically purely chemically activated resin modified GIC with no light activation at all. It is developed mainly for luting purposes, contains monomers and chemical initiators such as benzoyl peroxide and T-amines to allow cell polymerization. Used in pediatric dentistry for cementation of stainless steel crowns, space maintenance, bands, and brackets. Its advantages are no significant post-cementation sensitivity. There will be significant fluoride release, high compressive and fracture strength, no light activation required, easy placement, it is non-sticky, rapid finishing can be carried out, improved wear resistance, and solubility in oral fluids is very low. Now, low viscosity glass ionomer. This type of glass ionomer has been developed as liners, fissure protecting materials for hypersensitive cervical areas and endodontic materials. Such materials are designed with the low powder liquid ratios and highly flowable. These are used as fissure protection materials during the eruption period of tooth. That is, example like Fiji lining, LC, Fiji 3, Ketak and Do, etc. What are fluoride charged material? This is a modified glass ionomer and it is two-part material. One is a restorative part and another one is a charged part. The restorative part is used in the usual way, and when the first burst of fluoride is expended, the material is given a fluoride charge using a second. What are low pH smart materials? This material is based on the fact that fluoride should be released at low pH when caries attack may be more threatening. Hence, they are called as smart materials. The fluoride release is an episodic and not continuous. This prolongs the therapeutic usefulness of the material and optimizes the fluoride releases. What are bioactive glass? The idea of bioactive glasses was developed by Hench and Co. in 1973. This is an excellent material for use in maxillofacial and craniofacial surgeries as it performs better than hydroxyapatite. It takes into account that the fact that on acid dissolution of glass, there is formation of a layer rich in calcium and phosphorus around the glass. Such a glass can form initial bioactive bonds with the bone cell and gets fully integrated with the bone. It is being used experimentally. Uses are augmentation of alveolar ridges in edentulous areas, formulation of bioglass ceramics, bone cement. It is a root grad filling material. It is used in perforation repair. It is used in implant cementation. It's an infra-bony. It is used in infra-bony pocket correction. Now, we discuss about the fiber reinforced glass ionomer cement. That is incorporation of alumina fibers into the glass powder to improve upon its flexural strength. This technology is called as polymeric rigid inorganic matrix material. It involves the incorporation of continuous network scaffold of alumina and silica oxide ceramic fibers. It has increased the depth of cure, reduced polymerization shrinkage, improved wear resistance, and increased flexural strength. What is geomers? Geomers utilizes the hybridization of GIC and composite by using unique technology called as pre-reacted glass ionomer technology. Here, the fluoroaluminosilicate glass is reacted with polyalkyonic acid to yield a stable phase of GIC, and this pre-reacted glass is then mixed with the resin. Depending on the amount of glass which is used, here the reaction is full of the entire glass or surface of the glass. Proline containing GIC. It is an amino acid containing GIC which has better surface hardness and properties. This formulation of the fast-set glass ionomer showed increased water absorption without adversely affecting the amount of fluoride. Considering its biocompatibility, this material shows promise not only as a dental restorative material but also as a bone cement with low cytotoxicity. What are calcium aluminate GIs? This is a hybrid product with a composition between that of calcium aluminate and GIC, and it is designated for luting fixed processes. The calcium aluminate component is made by sintering a mixture of high purity aluminum oxide and calcium oxide, approximately 1:1 polar ratio to create monocalcium aluminate. Setting reaction is low water to cement ratio, immediate precipitation of hydration and saturation of solution grow and harden over the time, also known as hydraulic cement, and basic pH during curing and reduction in micro leakage, excellent biocompatibility and long-term stability and strength. The polyacrylic acid has got a dual function. Resulting material is composite of hydrated ceramic material and cross-linked with polyacrylate polymer. Advantage is compressive strength, shear bond strength, and they're all excellent. The working time is only 2 minutes, setting time is 5 minutes. The film thickness is 15 plus or minus 4 microns, and setting expansion is 0.4%. What are amalgamers? They are restoratives which are glass ionomer based, but with the strength of an amalgam. They also provide fluoride release, natural addition to the tooth structure, good compatibility, and prevent shrinkage, creep, corrosion, or thermal conductivity problem associated with other filling material. They have been found to have exceptional wear characteristics along with the other advantages of the GIC. What are hyonomers? Hyonomers, these are newer bioactive materials developed by incorporating hydroxyapatite within the glass ionomer powder. These are mainly being used as bone cements in oral maxillofacial surgery and may have a future role as a retrograde filling material. They have a role in bonding directly to the bone and affect its growth and development. Next, what are chlorhexidine impregnated GIC? It is developed to increase the anti-cardiogenic action of GIC and still under the experimental stage. And experiments are conducted in non-cardiogenic organisms. What is CPP ACP containing GIC? Here, casein phosphopeptide and amorphous calcium phosphate incorporated into the glass ionomer cement. And the incorporation is 1.56% weight by CPP ACP into the GIC significantly increase the micro tensile bond strength, that is 33%, and the compressive strength 23%, and significantly enhance the release of calcium phosphate and fluoride ions at the neutral and acidic pH. What are zirconia containing GIC? Zirconia containing GIC, it's a potential substitute for miracle mix. The diametral tensile strength of zirconia containing GIC significantly greater than that of miracle mix due to the better interfacial bonding between the particles and the matrix. What are nanobioceramic modified GIC? Nanohydroxyapatite and fluorapatite particles added to the G2 GC, and the GC containing nanobioceramics are promising restorative dental materials with both improved mechanical properties and improved the bond strength to the dental. There, so nanobioceramic modified GIC, nanohydroxyapatite and fluorapatite particles added to the GIC. What are powder modified glass ionomers, nanoglass ionomers? They are the modification of nanoapatite and the modification of nano-sized calcium fluoride and tin oxide particles showed that doping of conventional GICs with nano-sized glass particles can decrease the setting time and enhance the compression strength and elastic modulus. And hence, mechanical property adds to the serviceability and shelf-life of restorative materials as they are able to withstand the masticatory and the occlusal forces more effectively. Now, in conclusion, what I can say in conclusion is, dentistry can be characterized by move away from metal towards non-metal restoration. Motivation is mainly based on concern of aesthetics and biocompatibility. Such was the case with GICs. In dentistry, adhesion of restorative materials to structure is an important feature. It should possess identical properties and would adhere tenaciously to the surrounding enamel. So the glass ionomer cements are one of the products developed in this direction. Innumerable changes and inclusions were made in its properties and composition to overcome its inherent drawbacks. Few references which is quoted here. Thank you.